Common heart drugs with side effects not enough people know about. I'm Dr. Evan Levine, board certified cardiologist. If you enjoy my videos, like, share, and follow. Let's start with Brilinta ticagrelor. That's the medication that many take after a stent. Did you know it can cause a very uncomfortable shortness of breath? And in as many as 15% of patients, this likely occurs because it increases adenosine. Now, the problem here is the patient goes to the doctor after a stent. Now they have shortness of breath, and it's unrecognized that it's from the Brilinta, and poof, off to the emergency room and even admitted. Now, when I was in charge of a telemetry unit, I did see these cases. Number 2, ACE inhibitors. Again, drugs that end with april, lisinopril, enalapril, ramipril, etc. We spoke about angioedema of the throat and how dangerous that is, but it can also cause angioedema of the internal organs, especially the GI tract, leading to severe abdominal pain, nausea, and vomiting. And if missed, it can lead to multiple admissions. And I was an expert witness on such a case where the patient came to the emergency room 3 times and got better each time because she had stopped the medicine because she was nauseated and vomiting. Restarted again, back and forth. Eventually, they took her to the operating room where they found angioedema as the cause. P.S. She lost the case. Thiazide diuretics. We use that for hypertension, great drugs, but 5 to 10% of patients can get an increase in calcium because it reduces the amount of calcium in the urine, so more in the body. Now, if recognized and mild, no big deal. But if the doctor isn't aware of this, they can create an unnecessary evaluation for hypercalcemia. Now, high calcium, that can be caused by anything from hyperparathyroidism to cancer, but in this case, it's just the medicine. The medications Jardiance and Farxiga, we use that for anything from diabetes to heart failure, but it can result in unusual increases in urinary tract infections. Why? Because the medicine increases the sugar in your urine and bacteria like sugar. And finally, my favorite drug of all time, spironolactone, great for heart failure and cheap, but it can cause tender and enlarged breasts in about 10% of men. Be aware of this, and if this occurs, you can change to a medicine called eplerenone.